For people who don't know, rates of autism have quadrupled in the last 20 years. Fourfold increase. If you look at the CDC data, that's what they have on their website right now in 2023. Fourfold increase. How on earth can we understand skyrocketing prevalence of autism? Well, let me share another statistic with you. If you are a woman who is obese, you have double the risk of having an autistic child. If you are a woman who is both obese and diabetic, you have a fourfold increased risk of having an autistic child. If you're a man who is obese, you have double the risk of having an autistic child. So all these people are scratching their heads. Where's all this autism coming from? It's not the vaccines that we need to worry about. At the same time, the rates of obesity and diabetes are skyrocketing in men and women who are having kids. We are going to see skyrocketing rates of neurodevelopmental and psychiatric disorders. And when you look at these kids, even the kids who aren't autistic, where do you think the skyrocketing rates of depression, anxiety, suicidality, bipolar, everything else is coming in children? That too. This isn't about fat shaming. It's not about wagging our finger at the overweight woman. It's about trying to understand, why does she have mitochondrial dysfunction that is resulting in obesity? What happened to her? What is happening to her biology and physiology? And we need to address the root problem. And a pill, an SSRI, is not going to do it. And a stimulant is not going to do it. Those are symptomatic treatments at best. If we address the root problem, not only can we help that woman, but we can help that woman's children, and we can improve long-term outcomes across a wide range of mental and metabolic disorders.
Just to start, what's probably the most common or external environmental thing that you've noticed that impacts mitochondrial function the most?
You know, it's difficult for me to say, because I think I would venture to say diet or nutrition or the food that we eat is probably the most important thing, because it is so foundational to our existence. We don't even think about it. Like, we think about it in terms of like healthy diet, whatever. But if you go back in time when humans didn't always have food, it's the difference between life and death. Like, you've got to have food. It is foundational to human existence. So, but nowadays, with all the processed foods, all the artificial ingredients, man-made chemicals that are being put into our bodies, those things are having an impact on not only our metabolic health, like obesity and diabetes and heart attacks, but they're also having an impact on our brain health.
Yeah, you mentioned trans fatty acids, which were banned in 2018 in the United States. And we're causing all sorts of problems, right? Irritability, psychological symptoms. I'm sure it was contributing to metabolic health from an obesity, diabetes standpoint. Yeah. And it was also found to contribute to a dysfunctional mitochondria.
Yes.
Right?
Exactly.
So I think about that. I was like, that was 2018, man. That was like really recent, you know? And that just makes me think about what else is being put in our food that could be causing similar things that we just haven't caught on to yet.
Well, and unfortunately, we have caught on to some of them. Some of these ingredients we have been tested. We know that they cause mitochondrial dysfunction. Some pesticides, for instance, mitochondrial researchers actually use pesticides to poison mitochondria in petri dishes.
The same pesticides that are present in our crops.
Yeah. But some of them are just, they're going to be, it's going to be so disruptive to our society to change what we need to change. we need to start talking about all of the, people are worried about the environment and, what effect is air pollution and carbon emissions and all this stuff having on the environment. As a physician, I'm more interested in what impact is that having on the human body. And if you do the research, most of it centers on mitochondrial function, again, because mitochondria are so central to the function of cells. And so some of it is kind of known. But so I would say food. The reason food, diet, nutrition, whatever, the reason I hesitated on definitively saying food is because if somebody's not sleeping much at all, the soldier on the battlefield who's got access to food, but he's only getting 30 minutes of sleep in 24 hours for weeks on end, I'm going to say the biggest detriment to his mitochondrial function is sleep deprivation. Another situation, if somebody is drinking excessively, a gallon of vodka a day, that is a mitochondrial poison. And that person could in fact die from mitochondrial poisoning. We call it alcohol poisoning, but it's poisoning the mitochondria. And that is the cause of death with alcohol poisoning. So if somebody is in that situation where they're heavily, heavily using alcohol and drugs, that's going to be the bigger problem for them. So I say that, and some people start getting worried, like, oh, you're making it complicated, so that means it's going to be impossible to figure out. Well, those scenarios that I just gave you are not rocket science. Anybody with common sense would be able to look at that person, listen to their story, and be able to say, I think you might be having health problems because of the gallon of vodka a day. I don't know the mechanism of action. I don't know exactly how or why, but I think it's the alcohol. Anybody with common sense knows it. The soldier who's only sleeping 30 minutes a day, you don't have to be a sleep doctor, physiologist, a neuroscientist to understand that's not good for his health.
Right. Yeah. So are there any, back to food, are there any other additives that you would recommend to people to try to avoid from a metabolic function perspective? Some of the stuff that has, the most evidence in regards to metabolic function.
The easiest soundbite that I can give you with diet is eat real whole foods. So avoid as many processed foods as you can. Not everybody's willing to do that. Not everybody wants to do that. The more you can get rid of processed foods, the better. And so I'm basically, what is a real whole food? It's a single ingredient food. So meat, fish, eggs, poultry, fruits, vegetables, things like that. Those are single ingredient foods. You kind of know where they come from. You can make all sorts of delicious things with them. It's not like they have to be awful. But if it comes in a plastic bag, it's got 20 plus ingredients in it, that's called a processed food or an ultra processed food. And the reality is we don't know for sure exactly which ingredients in that might be harmful, which ones might be tolerable, which we just don't know yet. We do know some of them are harmful, but to go through that list, there are hundreds and hundreds of those ingredients. Right. So the easiest rule of thumb, eat real whole food.
Yeah. You mentioned, you talk a lot about insulin in the book too, and how insulin impacts mitochondria. And we can definitely see how diabetics would be affected by that, right? They develop insulin resistance, their mitochondria don't receive that signal, and there's dysfunction. And then that might be a good explanation as to the significant association between diabetes and mental illness. But something interesting that you pointed out is there's people with mental illness without diabetes that have been found to have insulin resistance as well. Is there any way you could talk about the role of insulin in mitochondrial function and specifically how it relates to mental illness?
Yeah. So probably the most compelling data is a longitudinal study. Over 5,000 kids followed for over 24 years, from birth to age 24. And the kids who had the highest levels of insulin resistance beginning at age 9 had a 5-fold increased risk for developing what the researchers called a psychosis at risk mental state. And so that means that they were at very high risk for developing schizophrenia or bipolar disorder by the time they turned 24. By the time they turned 24, they were already 3 times more likely to already be diagnosed with definitive schizophrenia or bipolar disorder. The kids who gained the most weight around the time of puberty, 4-fold increased risk of developing major depression. They were also at higher risk for developing psychotic disorders. And in that other group, they were also at risk of developing depression, but those didn't reach statistical significance. So we know that insulin resistance goes along with diabetes and goes along with obesity. But what that research tells us is that the insulin resistance is coming first. And then going on to put people at much higher risk of developing serious mental disorders, depression, bipolar, schizophrenia. Insulin resistance at a young age is also putting people at risk for developing obesity, diabetes, and heart disease. So they all go together. If you do a deep dive into the science of, well, what exactly is insulin resistance? What causes it? You're led to mitochondria. It's mitochondrial dysfunction. And then if you ask the question, well, what impact does insulin have on the brain? A whole new universe opens up. Most people know insulin as it relates to diabetes, type 1 or type 2 diabetes, and they think that's all insulin is. That's the diabetes thing. Well, no, actually, insulin has a profound impact on brain function. And when you get really granular and you look at, well, exactly which cells is it working on, and then what happens in that cell when insulin binds or when insulin is incorporated, it's mitochondria. Insulin is regulating brain energy metabolism. That is the easiest way to think about it. And so if there is dysfunction in insulin signaling, then you get dysfunction in brain energy metabolism, which leads to dysfunction in the way your brain works, which we end up labeling mental illness.
So optimizing metabolic health then optimizes your mitochondrial function. And has that been shown to increase insulin sensitivity to mitochondria itself?
Yes.
Yeah.
So the insulin resistance, in my mind, and this is controversial. I don't know that everybody agrees with this, but I'm gonna put myself out there and say, so I can tell you, I'm not trying to steal other research. Other researchers have already said this and published it and written it. So I'm not trying to steal their work. I'm not trying to take credit for their work, but I'm acknowledging not every researcher on the planet fully gets this yet. That's the way I would say it. Maybe they just don't agree with it. But in my mind, insulin resistance is mitochondrial dysfunction. So when mitochondria aren't functioning properly, insulin requires energy to work. So when insulin binds to a cell membrane, it gets incorporated. That part, the insulin and insulin receptor actually get engulfed within the cell. Mitochondria shuttle that to the cell nucleus, where it then transcribes genes and turns other genes off. And that results in changes to cell metabolism or output of different cells, because insulin is a broad, hormone. It's doing lots of things to lots of different cells, which all have different effects and functions. But that process that I just described is pretty clear. Mitochondria have to be functioning properly for that to happen. So if you think about it in this way, if a cell has impaired mitochondrial function, that process is going to slow down. Insulin binds, but it's not getting engulfed. It's not getting shuttled to the cell nucleus. That process is slowing down. And it's that slowing of the process that is really the definition of insulin resistance. Insulin resistance is the slowing of insulin signaling. And so in my mind, that's what insulin resistance is. So in those 9-year-old kids, their high levels of insulin were telling us they already have signs of mitochondrial dysfunction. And that is what is putting them at risk for both mental and metabolic disorders by the time they turn 24.
Very interesting. What about, so you mentioned you beat this dead horse plenty of times before, but we got to talk about it because, you mentioned this amazing Mildred case. How does the ketogenic diet then play into this whole thing?
So the ketogenic diet is something that started me on this path. And, most people nowadays have heard keto as the dangerous fad weight loss diet. So, the American Heart Association hates it. Lots of dietitians hate it. U.S. News and World Report, when they rank diets, keto's usually toward the bottom of the list. So if you talk to your primary care doc, you're more likely to hear, "Oh, don't do that dangerous keto diet. You'll have a heart."
Why is that? Why do people hate it so much?
They hate it so much, I think, because number one, I don't think they really fully understand it. Number two, they are still, at the end of the day, the real answer is they are phobic of the intake of fat. And so we, in the 1980s, 1990s, early 2000s, dogma, the unequivocal dogma in the nutrition field was that fat is bad for you. Dietary fat is the cause of all evil. Dietary fat is the cause of obesity. It's the cause of diabetes. It's the cause of heart attacks and strokes. If people would just eat less fat, everything would be fine. That has persisted to this day. It has been proven wrong in massive epidemiological and randomized controlled trials. We had the largest randomized controlled trial ever done, dietary intervention, 60,000 women, half of them low-fat diet, half of them keep eating what you're eating, which equals standard American diet. Followed them for 9 years. 0 difference in heart attack rate, 0 difference in stroke rate, 0 difference in any meaningful health outcome. That means the low-fat diet is the same as the toxic standard American diet. That's what that study tells us. Many people have trouble giving up dogma. When I was in school, if my professor taught me this thing, that's what I remember still.
Algorithmic thinking.
Algorithmic thinking. I can't change my algorithm. My algorithm is ingrained into my brain. I can't change the algorithm. Low-fat diet is where it's at. So I think that is why so many people hate the ketogenic diet, because it is intentionally a high-fat diet. We have dozens of randomized controlled trials, literally dozens of randomized controlled trials of the ketogenic diet for weight loss, showing that it is just as effective, if not more effective, than pretty much any other diet you can think of. It is just as effective or more effective and safe than low-fat diets, Mediterranean diet, any of them. We also have dozens of at least probably 90 or 100 randomized controlled trials, ketogenic diet for type 2 diabetes, all demonstrating benefits for blood glucose control, benefits for everything else. As a psychiatrist, so that gets to the metabolic health thing. So the ketogenic diet, evidence-based treatment for metabolic health problems. As a psychiatrist, that's not my main focus, though. As a psychiatrist, I'm interested in brain disorders. And fascinatingly, the ketogenic diet is a 100-year-old evidence-based treatment for seizures, epilepsy. It can stop seizures even when medications fail to. And that was the thing that was really the godsend to me as a researcher trying to understand how would a ketogenic diet stop Mildred's psychotic symptoms? Like, that doesn't make sense. And in the other patients I was treating, how can I make sense of this? We have decades of neuroscience literature documenting how and why the ketogenic diet stops seizures. All of those mechanisms of action are highly applicable to people with mental disorders across a wide range of diagnostic categories. So most people don't know, in psychiatry, we use epilepsy treatments like candy every day in tens of millions of people. We prescribe Depakote, Tegretol, Lamictal, Topamax, Neurontin, Gabapentin, Valium, Klonopin, Xanax. All of those medications stop seizures. But anybody listening to that list probably knows at least one of those medicines as a psychiatric pill. But in fact, they're epilepsy pills that we use as psychiatric pills. So using the ketogenic diet as a psychiatric treatment is in many ways nothing new. It's taking an epilepsy treatment and using it for psychiatric disorders. There are many mechanisms of action. It changes neurotransmitters. It decreases brain inflammation. It changes the gut microbiome, so the gut-brain connection. It changes gene expression. It does all these things. But the thing that's really central to my thesis is that it improves mitochondrial function in two ways. It stimulates something called mitophagy, which is getting rid of old and defective mitochondria, replacing them with new ones. And it stimulates something called mitochondrial biogenesis, or the production of new healthy mitochondria.
That's very interesting. What about stress? Stress has a significant, in your book, you mentioned stress has a significant effect on mitochondria.
It does.
Significant effect causing mitochondrial dysfunction, which you don't really think about, right? Because it's not a medication. You're not ingesting it, not in the typical sense. But it certainly affects your mitochondria and can contribute to mental illness. And I want to speak of it in the frame from a perspective of adverse childhood experiences. That's okay. Adverse childhood experiences have been shown to significantly contribute to adverse mental illness and mental health outcomes. And that's a pretty good proxy for stress, I think, especially early on. Can you speak a little bit towards that from an adverse childhood experience lens?
Yeah. So it's well established in lots of trials now, lots of studies that have been done. Adverse childhood experiences result in a wide range of mental disorders. So most people think of post-traumatic stress disorder. You have a bad childhood, you're going to have PTSD. Yes, that's true. But guess what else you might have? Pretty much all of the mental disorders, barring maybe some of the neurodevelopmental ones that should have occurred early in life. And so if it didn't happen to you early in life, then you're not going to get a neurodevelopmental disorder later in life. But adverse childhood experiences can also increase your risk for depression, anxiety, personality disorders, substance use disorders, but also schizophrenia and bipolar disorder. those are all of the major disorders. They increase your risk for developing dementia later in life. They increase your risk for dying an early death. But guess what else adverse childhood experiences increase your risk for? All of the metabolic disorders. They increase your risk for heart attacks, strokes, diabetes, obesity, Alzheimer's, dementia, and premature mortality. On average, if somebody has 6 or more adverse childhood experiences, comparing that person to somebody who has 0 adverse childhood experiences, the person with 6 or more ACEs lives 20 years shorter than the person with 0 adverse childhood experiences. So it is massive in terms of its effect on humans. And so right there, just those broad strokes help us see this connection between what we think of as metabolic health and mental health. They're interconnected, they're inseparable. But then we can get really granular. I can get into all the details, cell biology of what's happening. So, anytime you have a stress response, it's not a disorder at first. It's normal, like the soldier on the battlefield or the guy who loses his wife and 2 kids. They are going to be stressed, highly stressed. They don't have disorders yet. Their body is defending itself. Their body and brain are mounting metabolic resources for self-defense. And what does that mean? It means the human body goes on red alert. It means that you are hypervigilant. It means that your heart rate is going up. It means that your blood glucose is going up. Adrenaline levels are going up. Blood pressure is going up. All of these things are happening. Blood pressure, glucose, those are metabolic, right? That's what heart disease and diabetes is all about. Yes, that is your body mounting resources for self-defense. Already from day one, it starts taking a toll. So your body is going on red alert, all hands on deck to the self-defense system. And that means any other parts of your body or brain that might be fragile or vulnerable might start to fail. If you take somebody who's resilient and very healthy, metabolically speaking, they're not going to have any failures right away. They're going to have the standard stress response. They're still going to become depressed or anxious or hypervigilant or have PTSD symptoms, because those are normal, healthy human reactions to these stressful environments, to threats to our survival. But if it occurs over a prolonged period of time, it starts to take a toll, because your body is spending so much energy on self-defense that it means that other parts of the body and brain aren't getting routine maintenance work done anymore. Metabolic resources are no longer going to these other parts of the brain and body. And that means cells can start to get into a state of disrepair. When that happens, they can begin to malfunction. And then we might call that a metabolic disorder, or we might call it a mental disorder.
So we're thinking adverse childhood experience, the buildup of an adverse childhood experience, 1 to 6 or even more, then puts the body in sort of the hypervigilant stress state where you have the changes that you describe, and you begin to accumulate metabolic dysfunction in a certain part of the brain, which you're able to handle up to a certain point, where then you begin having symptoms of some sort of psychiatric illness. Is that about right in regards to the timeline?
Yeah.
So we know that adverse childhood experiences predispose someone to having post-traumatic stress disorder, which, saying it out loud, it fits really well, I think, into this theory where you have adverse childhood experiences, and then, this literature is in the military. So if you have a history of adverse childhood experiences and then you join the military and you have a traumatic event in war, then you're at significantly higher risk for having post-traumatic stress disorder. How does that fit in? I think I can kind of think my way through how that fits in, but
fits in perfectly. People with so, and even just with that, so again, so if you've got somebody with a lot of adverse childhood experiences, we're not looking for just one event. Somebody had a bad thing happen to them once in childhood, because most people get over that. They move on if they're otherwise safe and secure and have a decent life. So we're looking for a pattern of a lot of neglect, abuse, bad things happening, lack of safety over time. That, again, early on in childhood may all be quote unquote normal and healthy. That kid is at risk. The body is defending itself. That kid isn't going to sleep well. That kid's not going to be thinking well the next morning because he didn't sleep well. Now he's getting diagnosed with ADHD. I'm not always sure he's got ADHD. He may have trauma and PTSD symptoms or whatever. He may just have hypervigilance symptoms because of the trauma that's happening at home. But all of that is taking a toll. Those kids, again, are at increased risk of all these things. So if now he joins the military, has a traumatic event, he's much more likely than his otherwise resilient peers to develop PTSD because he's already vulnerable and fragile. If he develops PTSD, it tells us he was really vulnerable. He got pushed over the edge. If he gets pushed over the edge into PTSD, now guess what happens? What is the next 50 years of his life look like? He's at much greater risk for developing every other psychiatric disorder, every single one, other than neurodevelopmental disorders. They had to have occurred earlier in life by definition. So he's past that window. He gets a pass from neurodevelopmental disorders, but everything else in DSM, he's at greatly increased risk of developing. Substance use disorders, depression, anxiety, personality disorders, dementia, delirium, all of them. Bipolar, schizophrenia, all of them. He's at much greater risk. Guess what else he's at much greater risk of developing? All of the metabolic disorders. He's at much greater risk of getting diabetes, obesity, heart attacks, and strokes. And he's at much greater risk of dying an early death from all of that mess.
Right. Yeah, that's very interesting. You mentioned ADHD. You think there's mitochondrial dysfunction in it?
100%.
And that's causing ADHD?
Yeah.
Interesting. ADHD is being diagnosed in toddlers.
That's unconscionable.
It's unconscionable. Let me tell you something else, which you probably know. They're being put on stimulants because of that diagnosis.
That's the unconscionable part. I guess I don't mind the diagnosis because I could see a toddler having severe hyperactivity problems, but the first round of interventions for that toddler should be working with the parents and family. Let's look at this kid's diet. Let's look at this kid's routines. Let's look at the sleep habits. Let's look at safety. Let's rule out trauma, abuse, adverse childhood experiences happening in this kid's life. And let's address all of those before we resort to pills. Unfortunately, that's not the algorithm. It's common sense, but it's not the medical algorithm. The medical algorithm for the pediatrician is you've got symptoms. I see you running around. Here's a stimulant. Yeah. Next.
Yeah, and an interesting study came out, or an article came out regarding screen time and ADHD. And it came out recently, so I don't think it had come out but when you wrote the book. But you also mentioned it in your book that screen time predisposes to ADHD. But you said it in the context of do these kids have a mitochondrial dysfunction that is causing them to rely on the screen, and then that's just a byproduct of the mitochondrial dysfunction, pretty much.
It could go either way. I think we have enough evidence that screen time is really awful for human health. The more people are on screens, the worse their health, the worse their metabolic and mental health outcomes. There was a really powerful study that just came out in the past 6 months, so I didn't include it in the book, that looked at the age of cell phone acquisition for children. The younger the kid is when he or she gets first cell phone, the more likely they are to develop a mental illness. And it was a linear relationship, no ambiguity in that graph. If you give your 9-year-old kid a cell phone, much higher risk than 10, 11, 12, 13, 14, 15. Linear relationship. The younger the kid is when he or she gets first cell phone, the more likely he or she is to have a mental illness.
Incredible. All right, we're talking neurodevelopmental stuff. So what about autism? Is autism caused by mitochondrial dysfunction?
I would say yes, unequivocally. So surprisingly to a lot of people, that theory has been around for a long time.
There's a lot of theories around regarding autism spectrum disorder.
There are. And mitochondria are the way to tie them all together. People talk about vaccines, people talk about toxins, people talk about infections in mothers, people talk about dietary patterns, people talk about exposure to acetaminophen causing autism. All of those can be integrated through mitochondrial biology.
So you do think that vaccines cause autism through mitochondrial dysfunction?
So I'm not going to go so far. I'm not going to dive into the controversy of vaccines and vaccination. But what I will say is this, because the evidence for this is clear and unequivocal. Very high levels of inflammatory responses are associated with dramatically elevated risk of autism and most other mental disorders. So we have numerous animal models during fetal development or early life where researchers will inject the animals with lipopolysaccharide, which induces an inflammatory reaction, and that results in mitochondrial dysfunction, which then can increase the odds that that animal will show symptoms of autism or other kind of mental disorders. We also know it from human data. So mothers getting infections during pregnancy have elevated risk of those kids being autistic. Do vaccines cause an increase in inflammatory reaction? Yes, they do. Is there a range of inflammatory reaction depending on the person? There is. So in theory, I find it hard to say in no uncertain terms that it would be impossible for a vaccine to contribute to the development of autism. I don't see how any good scientist could say that.
Say that vaccines don't contribute to autism.
That it's impossible for vaccines to contribute to the development of autism. I don't think that's possible. With that said, I am going to go on the record and be very clear and unequivocal. Getting measles is a hell of a lot more toxic to human health and childhood health than getting a measles vaccine. There is zero doubt in my mind about that. So I am pro-vaccine for the most part. Even with this slight risk, if you eat nuts, is there a risk you could die? There is. You could be allergic to nuts. You could have an anaphylactic reaction. Is that possible? Yes. Do we have evidence of that? Yes. Am I willing to go on record and say nobody should ever eat nuts because of that possible rare reaction? No, I'm not. So just what I'm hopeful with with that particular issue. So when parents have a child that appears to be neurotypical, gets a vaccination, or has COVID, or has another infection, or whatever, and then they notice, whoa, my kid is different, something's happened. Or they send the kid in for surgery. Surgery has complications. Kid is exposed to a lot of anesthesia as a result. Kid comes back and isn't the same. Seems to be different. What I would say is that if people can wrap their brains around the science of what's happening, we can actually intervene at those points. We don't need to just wait and allow this to progress to a life of disability and autism. We can do something about those situations. We can intervene using metabolic mitochondrial treatment strategies to help the person regain his or her health. So coming back to the bigger picture of autism, I would say that the mitochondrial theory of autism was first proposed in like 1986. It's nothing new. We have an abundance of evidence that people with autism have metabolic problems in their brains and or bodies. The problem is that metabolic problems can have lots of different causes, as we've been talking about. It could be a bad diet, but it could also be stress and trauma. It could also be an infection. It could be a hormonal imbalance. It could be poor sleep. It could be drug and alcohol. So lots of things can cause metabolic dysfunction. So there's not a one-size-fits-all cause. And we need to wrap our brains around that and accept that. It's obvious and it's a fact. But yet people are still searching for, well, what's a single cause of autism? Because we've got this algorithm and we've got this diagnostic label. The diagnostic label says autism is one thing, therefore it must have one cause. And so we're spinning our wheels trying to find this one cause when any decent researcher or clinician should already know there isn't one cause. There are numerous causes.
Yeah, but you said that vaccine, inflammation leads to mitochondrial dysfunction, which could then lead to autism.
Yes.
Right?
That is the unifying link. And again, the reason that's helpful is because we can intervene by identifying the myriad of contributing causes.
Right, but there's a lot of things that can cause inflammation, especially in a child that's who is supposed to mount inflammatory responses secondary to different antigens, right? But this one vaccine, you're saying, increases inflammation more than they're used to, which causes mitochondrial dysfunction, which then causes autism. Versus some of these other things that they're exposed to that cause inflammation.
Yeah. So we know that having a serious infection that leads to hospitalization in children is highly associated with increased risk for a wide range of mental disorders, including autism. So if your kid is hospitalized for a serious infection, doesn't matter what it is, if you have a kid who's hospitalized for a serious infection, he or she is at greater risk for developing a wide range of mental disorders. The most common mental disorder after that is actually OCD. But autism, schizophrenia, learning disorders, all sorts of problems can happen. And what I'm saying is that there are kids who are vulnerable going into that situation. Just like the soldier. Some soldiers are going in kind of resilient. Other soldiers had horrible adverse childhood experiences. If you have those two soldiers right next to each other, they both experience the exact same traumatic event on the battlefield. The one with adverse childhood experiences is much more likely to come out with PTSD than the one who went in resilient. So some people would look at that situation and say, well, it was the trauma on the battlefield that caused the PTSD. And I would argue, yes, that was the thing that pushed him over the edge, but it was all of the other stuff that happened to him before that that led up to it, that made him vulnerable. So same deal with a kid with an infection or a vaccination or anything else, that if a kid is coming to the table vulnerable already, then something might push them over the edge.
Last question regarding autism, because we could go on all day about this, right? Have risk factors been shown to predispose to autism early in life, trauma, metabolic disorders, anything else that you've described that causes metabolic dysfunction? Has that been shown to predispose to autism spectrum disorder?
Yeah. So the rates of autism, for people who don't know, rates of autism have quadrupled in the last 20 years. Fourfold increase. If you look at the CDC data, that's what they have on their website right now in 2023. Fourfold increase. How on earth can we understand skyrocketing prevalence of autism? Well, let me share another statistic with you. If you are a woman who is obese, you have double the risk of having an autistic child. If you are a woman who is both obese and diabetic, you have a fourfold increased risk of having an autistic child. If you're a man who is obese, you have double the risk of having an autistic child. So all these people are scratching their heads. Where's all this autism coming from? It's not the vaccines that we need to worry about. At the same time, the rates of obesity and diabetes are skyrocketing in men and women who are having kids. We are going to see skyrocketing rates of neurodevelopmental and psychiatric disorders. And when you look at these kids, even the kids who aren't autistic, where do you think the skyrocketing rates of depression, anxiety, suicidality, bipolar, everything else is coming in children? That too. This isn't about fat shaming. It's not about wagging our finger at the overweight woman. It's about trying to understand, why does she have mitochondrial dysfunction that is resulting in obesity? What happened to her? What is happening to her biology and physiology? And we need to address the root problem. And a pill, an SSRI, is not going to do it. And a stimulant is not going to do it. Those are symptomatic treatments at best. If we address the root problem, not only can we help that woman, but we can help that woman's children, and we can improve long-term outcomes across a wide range of mental and metabolic disorders.
What about mental illnesses and psychiatric issues that might not involve metabolic dysfunction? Are there any, or do you think they all do?
Well, so again, mental illness falls into this category that we call mental states, or that I call mental states. So the guy who loses his wife and 2 kids, most people are going to say he's got a mental illness. It doesn't even have to go on 2 weeks. They're going to say, oh my God, he needs help. He needs help. He's talking about dying, and he can't get out of bed, and he's not eating, and he's not taking care of himself. He's got a quote unquote mental illness. Do I think that he has a brain disorder due to mitochondrial dysfunction? I don't.
What do you think about some antisocial personality, a serial killer with antisocial personality disorder?
So antisocial personality disorder, in theory, could come from a few different, it could result in a few different ways. But for the most part, if it's a true case of sociopathy, by definition, in order to diagnose antisocial personality disorder, the person has to have had conduct disorder. So by definition, this is something that begins very early in life. And the kid has no empathy, has no regard for the suffering of others, has no regard for rules, has little regard for what's right and wrong in terms of morals and ethics, and is all about whatever makes him happy. If taking something it serves him well, he'll take it. He doesn't care as long as he doesn't get caught. If killing somebody or killing animals, torturing animals, if that's fun for him to just watch, he'll do it. No regard, no empathy. That is the classic case of sociopathy.
There's usually trauma associated with that, though, no?
Not always, sadly. Not always. Sometimes there is. The way that I would understand that sociopathy is that it is a neurodevelopmental disorder that results in the brain malfunctioning.
So you're saying, so are you saying there's mitochondrial dysfunction?
There is mitochondrial dysfunction.
In antisocial personality disorder?
Yes.
Okay.
And there, again, so for people, for people who have trouble understanding that, what I'm really saying is that person has cells in the brain or networks in the brain that aren't working properly. They're either overactive or underactive. That's what I'm saying. We know that's true from all sorts of neuroimaging studies and all sorts of other, we got decades of science proving this. Overactive, underactive brain regions. Where our field is stuck is in this question, well, what causes that? Is it serotonin imbalances? Is it dopamine imbalance? What causes that? And what I'm saying is that we need to go subcellular to answer that question.
Right.
And that it's mitochondrial dysfunction. Now, on one hand, some people are like, mitochondria can't be everything. And if that's what people think, they have a lot to learn about mitochondrial biology and the revolution in the medical field and biology field that has occurred in the last 20 years. You're not getting it. If people don't understand, mitochondria are central to the function and health of cells. There is no way around it. So when I say it's mitochondrial dysfunction, I'm not trying to say it's simple. But what I'm saying is it's understandable. And yes, more research might lead to more granular understanding of why is this person developing antisocial personality disorder and another person is developing alcoholism and another one's developing schizophrenia. And that might lead to new treatments or pills or other interventions that might be really helpful and invaluable. But in the meantime, just understanding the concept of why would these cells malfunction, understanding that it's mitochondrial in nature, immediately opens up a whole new world of interventions, just like we have interventions for obesity, diabetes, and heart attacks. We do know what to do, and most of it is common sense.
Yeah, I just wonder if and an element of it excites me, but I do wonder if we're contributing pretty much the entire human condition to the function of mitochondria. What do you think?
What do you mean?
If you're anxious, if you're excited, if you have anxiety, if you have depression, if you have antisocial personality disorder, if you have urges to kill people, all that just seems to boil down to mitochondrial function.
Well, again, I would say it boils down to the function or dysfunction of cells. And at the end of the day, if you get really granular about, well, what would cause a cell to function properly or malfunction, you do have to invoke mitochondria into that process. One way to think about it, if it's helpful, is that, multicellular organisms, so organisms that have more than one cell, are this interconnected network of cells. And there's always this, it's changing constantly. about what cells are getting energy and which cells aren't getting energy, which cells are dying off, which cells are being born. There's this constant changing evolution, and it's all adaptable and flexible depending on what circumstances we're exposed to, whether we're eating a lot or a little, whether we're freezing to death out in the cold, whether we're in heat in the desert, whether we're sleeping or not, whether things are threatening our lives. Our physiology is constantly adapting, but all of the different cells in the brain and body have to adapt as a result. Some are getting turned on, some are getting turned off. And at the end of the day, when we look at that interconnected network, it involves hormones, neurotransmitters, the nervous system, all sorts of things. But again, if you then look at, well, what exactly causes the release of those neurotransmitters? What causes the release of those hormones? If you really ask those granular questions, we do know the answer now. The answer is mitochondria within the cell. So the mitochondria, in another way to think about it, is mitochondria are this interconnected network, that they exist within individual cells, but they're actually communicating with other mitochondria to determine what's the optimal homeostasis for this organism at any given time. And again, it's constantly changing. Sometimes we need to sleep, that changes things. Sometimes we need to run, that changes things. Sometimes we're eating, sometimes we're not eating. It's constantly changing. But that's the reason I can keep saying mitochondria is because mitochondria are foundational to the function of cells.
Sure. Now, let's bring it home. What are actionable things that anyone listening can do, whether they're, suffering, they don't necessarily have a mental illness, but they're suffering from anxiety-like symptoms, depressive-like symptoms, or they do have a mental illness, that they can do, actionable things that they can do in order to improve their metabolic function and hopefully improve some of the symptoms that they're having?
So it's really going to depend on the person and the circumstances. So because again, it's there's not a one size fits all solution package. If you're an alcoholic drinking heavily, that's your solution. That's step number one, at least for you. If you're somebody who's not sleeping, that's solution number one to you. If you're in an abusive relationship, getting to a safe place is solution number one to that person. So I can't offer a one size fits all solution, but the comprehensive holistic package, if you're brain fogged, mildly depressed, burned out, anxious, what should you be thinking about? I want you to look at your diet. If you're overweight or obese, if you've got signs of insulin resistance, which a lot of people don't know this, but 50% of Americans have prediabetes or diabetes. 50%. So if you're a little bit overweight, it's all in the gut. In particular, if you've got a lot of gut, you probably have a lot of visceral fat, which makes it much more likely that you've got insulin resistance or prediabetes. If you've got that, that means that already you've got a metabolic problem, and it's probably affecting your brain. And so if you're suffering from symptoms like burnout, depression, anxiety, whatever, there's a good chance that that's playing a role. And the easiest thing to do is clean up your diet. Think about changes. I'm not going to give a one-size-fits-all prescription because some people want to be vegan, other people want to be vegetarian, some people like animal-sourced foods, they like a lot of meat and eggs, and I can work with any of those people. Like, all of those are options. You can lower your blood sugars on any of those types of diet.
So should that be the goal regarding dieting, is lowering blood sugar?
Lowering blood sugar in order to improve insulin signaling. And the easiest concrete one size fits all solution I'm going to give is eat real whole foods. Get rid of the processed junk food, get rid of added sugars. Don't drink calories. Drink water, coffee, tea without sugar. A lot of people are like, well, that's boring. And I'm like, well, how's life being burned out and anxious and depressed? Like, how's that working out for you? What most people don't realize is that if you make diet changes like I just outlined, the first 2 weeks really suck. No, I'm not going to sugarcoat it. They're going to suck. You're going to hate life. You're going to feel like there's no way I can live the rest of my life without my sweets. I need to treat myself. If you can actually do 3 months of that, you actually won't miss it as much or at all anymore. And more than likely, if the dietary intervention works for you, you will be a new person.
Is there a marker of insulin sensitivity, like a blood biomarker of insulin sensitivity that you know of?
I mean, there are numerous.
Okay.
So you can just do a finger prick blood glucose fasting. Should certainly be less than 100. Yeah. And again, for a lot of people with prediabetes, it's not, or diabetes, it's certainly not by definition. Some people do continuous glucose monitors. You can get a fasting insulin level from your doctor that can show insulin resistance. So there are lots of measures for it. Most of them you're probably gonna have to work with your healthcare provider to figure out what's best for you. But fasting glucose is cheap and easy, and your healthcare provider should be able to do that with you.
I love exercise, as you know, it builds autonomy, taking control back in terms of your symptoms and your mental illness. You describe a lot of stats in regards to the benefit of exercise, aerobic especially. Anything you want to mention in regards to someone doesn't exercise, they're looking at exercise to kind of take back control of their symptoms? What would you suggest?
So, huge fan of exercise, and there's zero doubt. People who exercise a lot have better metabolic and mental health, and exercise as a treatment can be really powerful. It usually needs to be coupled. So exercise alone, you can't stay on your junk food diet and think you're going to outrun a junk food diet. You're not.
Yeah.
You're not going to be able to outrun or outlift a junk food diet. You're also not going to be able to outrun or outlift bad sleep. Those are the 3 pillars in my mind: diet, nutrition, exercise, and sleep.
Can I just interrupt you real quick? Because I found it extremely interesting regarding exercise, and I think, was it insulin sensitivity? If you continue to eat junk food, for example, right, you continue to express insulin resistance despite I think you mentioned 45 minutes of aerobic exercise 3 to 5 times a week, you continue to have insulin resistance.
Yeah.
Right.
So exercise alone, like I was just saying, exercise alone is not going to outrun a bad diet and insulin resistance. And actually, here's the frustrating thing for some people, but again, knowledge is power. So don't get frustrated with this, get empowered with this.
There you go.
People who have high levels of insulin resistance. So if you are obese or already a type 2 diabetic, you have high levels of insulin resistance. Those people actually early on do not get the benefits of exercise right away. And there was one study that actually showed that exercise actually kind of caused higher levels of inflammation in them afterward, whereas in healthy people, it's the opposite. So healthy people get the adrenaline high. You probably get it. I get it. We feel good after we exercise. And if we don't exercise, we feel bad. And then that motivates us to go exercise again. If you're already obese and metabolically compromised or type 2 diabetic or mentally ill, there's a good chance exercise alone might even make you feel a little worse early on. I say that knowledge is power. I'm going to tell you, push through that discomfort, push through that. But to that person, I'm going to more invoke the dietary changes. So clean up your diet at the same time or even before you start the exercise plan. But then to get started, I mean, it can be anything. You know this better than I do, but it can be anything. If you don't do anything, if you are 100% a couch potato, go for walks. Start with walks. If you can't walk far, walk around your house a couple of times and walk up and down the steps if you have steps in your house. Build up to get outside in nature, get some sunlight on your face any time of day, whatever. Get outside, build up to walking. Try to increase the intensity. Like, do that for a week, but then increase the intensity. I'm going to walk faster, or I'm going to swing my arms more, or I'm going to take longer strides. I'm going to do something that's going to increase my capacity. At the same time, you could start, resistance training, try to build some muscle. Muscle is great for, muscle has mitochondria. Those muscles actually are sending signals to your brain that impact your brain health. So bigger muscles actually are associated with better brain health.
Now you say that people that are obese and already have like really severe insulin resistance, you're telling them push past because that, for them to gain insulin sensitivity, it's just going to take a little bit longer than the average person.
Yes.
Yeah.
And that it might hurt them more in the short run.
Yeah.
So, but this is the challenge, and this is where a lot of people go wrong. The obese person comes to this really fit trainer. The fit trainer says, you are going to feel so great after a good workout. Don't worry. I'm going to help you. I'm going to show you how it's done. And then this fit trainer is going to say, there, don't you feel great? Like the next day, don't you feel great? I feel great. And the person's going to say, no, I actually feel worse.
Yeah.
And the fit trainer's going to think, you're making excuses. You're lazy. What I'm saying, knowledge is power. No, that person really does feel worse. We know that from studies. We know it from studies published in the top biological journals like Cell. That person really does have higher levels of inflammation. That is making them feel worse. They have a right to complain. It doesn't mean they have a right to stop, but the trainer needs to stop telling them you're going to feel great. That's not true. It's not accurate. The trainer needs to tell them, you might feel like shit tomorrow, and we're going to get through it. And I'm going to be here with you. And why are we going to do it? Because a month from now, you are going to start feeling better, and you're going to be stronger and faster. And that's when you're going to get the rewards. But in the short run, it's going to be painful. When I work with an alcoholic and try to get them to stop drinking, I don't say, I'm going to send you to this detox and you're going to feel great. I don't say that.
Yeah.
I say you're going to feel probably the worst you've ever felt in your life. It's going to be horrible, painful. You're going to be shaking, probably insomnia. It's going to be awful, but they're going to get you through it. They're going to keep you safe. They're going to take care of you. They're going to make sure nothing bad happens to you, but it's going to be painful. Why am I asking you to do this? Because 2 months from now, you're going to have a new life. But you got to get through the hard part first. And I think we need to be giving those types of messages to people who are metabolically or mentally compromised, because it's not fair. If we mislead them and make them think it's all going to be great, then they think either you don't know what you're talking about or there's something wrong. Like, I'm sick because I'm not feeling better. And clearly whatever you're recommending to me isn't safe. And you're assuring me that I should feel better, but I don't feel better. I actually feel worse. So either you're an idiot, you don't know what you're talking about, or I'm just a lot sicker than anybody you've ever worked with.
Yeah. Yeah. Now, so we said diet, exercise, mentioned sleep. 8 to 9 hours is the recommendation that I thought I heard in your book.
7 to 9.
7 to 9.
So yeah, 7 is usually enough. Some adults every now and then can get by on 6.
Yeah.
Any less than 6, I'm not going to be a big fan of. But the goal is sleeping well, sleeping through the night. Here are the huge 2 goals: waking up feeling refreshed, being able to get through the day without dozing off. If you don't feel refreshed when you wake up and you're dozing off through the day, there's something wrong with your sleep.
Outside of the time?
There's something wrong with your sleep. And it could be time, it could be quality of sleep. If you're using a lot of medications, if you're drinking every night, that's going to mess up your sleep quality. But if you are overweight or obese or have type 2 diabetes or a mental illness, you're at much higher risk of having sleep apnea.
Mm-hmm.
And that's not within your control. That's not an easy thing to fix. You need to get evaluated for sleep apnea, and you might need a CPAP, at least while you're on your journey. If you can lose the weight, if you can get into better metabolic health, the sleep apnea can go away. You can put that into remission so that you don't need a CPAP machine. But in the meantime, you may need the CPAP machine to get you through, or you may need it for life. But those are the 2 most important metrics: waking up feeling refreshed, getting through the day without dozing off.
Yeah. You mentioned medications affecting sleep. You also mentioned medications affecting metabolic function. And I think that's really important because, America is a medicated society, right? Fact of the matter. So, and even some of these psychiatric medications are causing like paradoxic metabolic dysfunction, right? Where maybe you have like a improvement in function initially, but then in the long run you have some like dysfunction that happens. Can you mention regarding medications causing metabolic dysfunction, and if there's anything that people out there should look out for in regards to being on a medication that might be causing metabolic dysfunction and thus some of the symptoms related to their mental illness?
Yeah. So the first thing I want to say before I dive into this at all is, if you are on a psychiatric medication, please get professional help before you try to adjust your meds or go off your meds. It is a dangerous, life-threatening nightmare for you to adjust your meds on your own. I have seen numerous patients get suicidal, depressed, manic, psychotic, all sorts of things when they take their medication matters into their own hands. With that said, this theory raises serious concern about medications that cause metabolic dysfunction. We have lots of them in the mental health field. Antipsychotics, mood stabilizers, some antidepressants, and others are known to cause metabolic dysfunction. For the most part, people think about them as just side effects, unfortunate side effects. What I'm arguing is that if you actually understand the granular science, they're not side effects, they are effects. That we are trying to stop hyperexcitability in metabolically compromised cells. And there are 2 ways to do that. One would be to restore the metabolic health of the cell so that people can go on and live happy, productive, good lives. The other is to give them a medicine that shuts down their mitochondrial function or suppresses it enough to suppress the hyperexcitability. And that can result in relief of symptoms, sometimes even remission of symptoms temporarily. But for the most part, long term, shutting down metabolism in a cell or suppressing metabolism or mitochondrial function in a cell is likely to lead to a chronic progressive illness that is not going to get better, but only going to get worse. And that sounds really awful and dire and pessimistic. And do we have any data to support what I just said? And in fact, we have an abundance of data to support what I just said. If you get diagnosed with schizophrenia, for the most part, you are going to have a chronic, progressive, horrible illness. If you get diagnosed with schizophrenia, you have a 20-fold increased risk of having dementia on top of your schizophrenia by the time you turn 66. You're on average, you're going to die 20 to 30 years younger than other people. So do we have evidence that that type of treatment might impair metabolism long term and might lead to other mental disorders and might lead to premature mortality? We have an abundance of evidence. But again, I am not a big fan of, some people are anti-psychiatry because they hate the effects of those medicines. I don't blame them at all for hating the effects of those medicines. Those medicines are mitochondrial toxins and they make people feel awful. But I'm not a fan of, therefore, the alternative should be just don't use psychiatric treatments at all and let people suffer and kill themselves or kill others or run amok in society. Like, let's just have a free-for-all and forget mental illness exists. We can't do that. I mean, more than 50% of the people in prisons have a mental illness. And most of them are there because of their mental illness. That's what happens when we just ignore the reality of psychiatry. More than 50% of homeless people are mentally ill. They have schizophrenia or drug abuse. I'm not a fan of just letting those people suffer and wither away in our prisons and our homeless shelters. Instead, I'm a fan of using science. If people understand the science, they can understand how and why a toxic medication might reduce symptoms in the short run. But they can also understand why a clinician needs to try to get the person off that medication at the same time while implementing other strategies that will restore health. Because simply taking the person off the medication, it's too late.
Now, let me interrupt you. Are you saying that the medication itself that's administered to people with schizophrenia or other mental illnesses that have a significant predisposition to dementia, that the medication itself is causing mitochondrial dysfunction and then subsequently leading to dementia?
Well, we know for certain it is causing mitochondrial dysfunction and leading to Parkinson's disease or Parkinsonian symptoms. It is leading to something called tardive dyskinesia. It is leading to tremors. It is leading to dystonias. We know that for certain. That's been known for a couple of decades. Why are these medicines toxins? What are they doing to cause Parkinsonian symptoms? They're poisoning the mitochondria.
So there's one side of things where you're saying, hey, schizophrenia, mental illness, there's mitochondrial dysfunction. Mitochondrial dysfunction predisposes to dementia, right? But at the same time, it's the medication that you administer is restore mitochondrial function initially, but then causing mitochondrial dysfunction later that then leads to dementia.
It doesn't restore. So antipsychotics don't restore mitochondrial function initially.
Okay.
Antipsychotics impair mitochondrial function out of the gate.
Right. But what I'm saying is there's mitochondrial dysfunction that the person has due to their illness, right? And what you're saying is that's not the mitochondrial dysfunction that's leading to dementia. It's the mitochondrial dysfunction that is caused by the medication that's administered to that person.
No, I'm not. So
I just wonder what would happen if no medication was administered.
So what would happen if no medication is administered?
Would they predispose to
They would
dementia?
they would still probably die early deaths and have much higher rates of obesity, diabetes, cardiovascular disease, and dementia. So in the 1800s, it was all before the antipsychotics were even invented. In the 1800s, researchers knew insanity and diabetes run in the same families. Insanity is schizophrenia and bipolar disorder. That's what that is. And so it wasn't the pills. But I do believe the pills are pouring gasoline on a fire. That these people are already metabolically compromised. And in order to reduce their symptoms, we are shutting them down even more. Let me give you a clear example. So some people might interpret, based on what I just said, that I'm 100% opposed to ever using antipsychotics. And let me be clear, I'm not 100% opposed to using antipsychotics. The clearest example I can give is another field called oncology or cancer treatment. In the oncology field, we use metabolically toxic substances and therapies like radiation therapy to kill cancer cells. Those substances and treatments are also taking a toll on the rest of the person's mitochondria and cells. It is reducing their overall health. People feel awful on these medications, but these medications save lives. The alternative is to let them die of cancer. I'm not a fan of just letting people die. If somebody is running amok and dangerous and agitated and assaultive because of their psychotic episode, they need to be made safe any way possible. Chaining them to a wall is not humane. I personally think it's more humane to give them an antipsychotic to make them safe. With that said, just like chemotherapy is used for a phase of the illness, we don't keep people on chemo for life. Because if we keep them on chemo and radiation for life, guess what will happen? They'll develop more cancers. The treatment becomes the cause. And what I'm saying is it's the same deal in psychiatry. The treatment can become the cause. And we need to own, the oncology field gets it. They know that. They don't shy away from saving lives, but they also don't put people on chemo and radiation for life.
That's a very interesting comparison. Yeah.
I think we in the mental health field need to step up to what they're doing in oncology, that we need to acknowledge we are administering toxic medications. We can understand how and why these are reducing symptoms and making a dangerous situation safe. But we also need to be very mindful, as soon as possible, we need to implement other metabolic treatment strategies and try to get them off of this mitochondrial toxin. That's the approach I'm hoping to work for.
Amazing. All right. So we've got actionable things to do. Diet, Mediterranean or keto, or just cut everything, cut all the junk food out.
Yes.
At the same time, exercising. Any amount is good. I'll say 3 to 5, 45 minutes aerobic exercise, and also build some muscle. Build some muscle means building mitochondria.
Yep.
Sleep 7 to 9 hours, and making sure that it's quality by waking up refreshed and not dozing off during the day. And then finally, get off medications if you can, and do it safely, and do it with the guidance of an experienced healthcare provider like Dr. Palmer or myself. Yes. I'd like to think so. After this 3-hour podcast, that I'm a little bit more experienced in that regard. So, thank you so much for joining. Do you have any final words?
I think if people are interested in this, I really do want to see change in the mental health field. Right now, people with mental illness often don't even get access to mental health care. They can't find a therapist or a psychiatrist to deliver any treatment, even standard treatment. Many of them are withering away in prisons and jails and homeless shelters. Millions more are withering away in their homes, disabled, meaningless, purposeless lives. So already our system is horribly broken and failing people with mental illness. And I'm asking for massive changes to an already struggling, failing system. And so I really do hope to ignite a grassroots movement in which people with mental illness or their family members, their loved ones, are going to say enough's enough. This science, this theory offers an entirely new path with tremendous hope. So if people are interested in getting involved, they can come to brainenergy.com, sign up for our newsletter. You could volunteer to help us out. We need all the help we can get. You can spread the word. You can tell other people about the brain energy theory. You could read the book. You could ask your library to get the book. You could recommend the book to friends and family who might benefit from this information, or recommend this podcast to friends and family who might benefit from this information. So it doesn't have to be money, but we need massive changes. And in order to get massive changes, we need a lot of people. And the reality is hundreds of millions of lives are at stake.
Yeah. Where can they follow you on social media?
So I am most active on X, formerly known as Twitter. So people can find me there. I'm also on Instagram. I'm on Facebook. I don't check into my Facebook account as much. So X or Twitter would be the best place if they really want to.
What are the handles?
See. Chris Palmer, @Chris Palmer MD.
Okay, perfect. For both of them?
Yeah, for all of them, @Chris Palmer MD. And if you go to the website, you can get the links to all of that stuff.
Yeah. Thanks for coming. I really appreciate it. I'm not a psychiatrist, right? But, I deal with a lot of patients who have experienced trauma. And I deal with a lot of patients who are having really severe mental illness. I see it. I see the suffering firsthand. I can only imagine the kind of stuff that you see. But I agree with you 100%. I think when you look at the rising mental illness in our society, I think it's an epidemic at this point. I think that what we're doing is not efficacious enough. People deserve to have better treatment than just, a 30% improvement on SSRIs, for example, right? And I think in order to do that, a revolution is absolutely going to be necessary. And I hope that the brain theory can be that revolution. And if it can be, then, I'm completely on board. I hope that this is going to shift the way that people look at mental illness. I hope that it'll also set a foundation off of which we can base further treatments and further research. I really look forward to your future, your theory's future, and the improved management of people with mental illness in the future as well. Thanks so much for coming. Thank you, everyone, for watching. And most importantly, stay safe, be well.